Welcome back. In this video, we'll talk about the ethical principle, beneficence. It simply means that the treating physician must do what's best for the patient. So the physician has to stay updated and follow the clinical guidelines. But they have to know when to not follow the guidelines, as some treatments are beneficial for one patient but not the other. In other words, doing what's in the patient's best interest. Beneficence principle often collides with autonomy principle, as the patient's autonomy can prevent the physician from delivering the best treatment. For example, if an old patient is living on her own and she fell down in the shower and broke her hip, she then comes to the ER, and the ER doctor explains that the patient must be immediately taken to surgery for hip replacement. Now the patient can refuse the surgery, it's their autonomy. And this affects the beneficence principle. So in this case, the physician has to go to the second best thing in the patient's interest, which is providing analgesia. Basically taking the pain away. Again, this is not ideal, but it's in the patient's best interest. To follow the beneficence ethical principle, a healthcare worker must consider the patient's individual circumstances, stay updated to the latest guidelines and follow these guidelines, maintain the high level of skills and knowledge. And here's a small quiz. Try to identify whether or not the physician in this scenario practiced beneficence. Alright guys, that's all I have. Thank you so much for watching and hopefully this helps.